What's up, dudes? Discussion 12. Do a quick review of scenario. Um, Man outside the county building fell, hit his head, bleeding. Arrival on EMS crew. Patient has alcohol history along with epileptic seizures. Crowd stands around, says, hey, he had a seizure lasting for several minutes. No report that he turned cyanotic. The crew did a good job of attempting to put a OPA in, notice gag reflex. Patient accepted NPA, got him on backboard, started seizing again, rolled him over on the side and suctioned airway. They seemed like they did a pretty good job on handling it. Number one, why was the airway a concern in this patient? Because starts seizing, he can bite his tongue, compromise the airway, maybe vomit, especially with alcohol. He could compromise his own airway from seizing. Maybe when he fell, he broke some teeth. So they're not sure. That's a big thing, and just making sure patient, especially possibility has a good airway and unconscious. Airway is always a priority when it comes to an unconscious patient or somebody who's not responsive to verbal stimuli. Besides epilepsy, what are the other causes of seizures might be possible? Falling, hitting his head, the severity of the impact, the blunt trauma to his head could have caused a seizure. Depending on how severe it was still oozing blood, so that could have caused the seizure also. The alcohol with the history, and maybe those two could have caused a seizure. So why would the paramedic not immediately intubate his unconscious patient on scene? Well, the number one thing was because patient had a gag reflex and couldn't take the oral airway, so they had to use an NPA. And so if he wanted to intubate, he'd have to sedate the patient, or probably give him a paralytic as well, so the patient wouldn't have a gag reflex. But if the patient has gag reflex, you don't want to intubate him because that'd be bad. Yep, that would be bad. So there's my answers. Yeah.